up, that would be great. Hi, everyone.
Hi, everyone. Yes, I'll get us started. I know we have a very packed agenda today. Good afternoon, everybody. Welcome to the Continuum of Care Board meeting. I'm going to go ahead and call this meeting to order. My name is Tamara Wright. I'm with Community Solutions, and I'm currently the only COC board chair. I will now commence roll call with each of the board members' names and ask you to please introduce yourself and your organization, starting with Ryan Balch. Are you on? Eric Cole.
Hi, Eric Cole with the Design Studio for Community Solutions at ASU.
Hi, thank you, Eric.
Yep.
Do we have Elizabeth DaCosta? Okay, Marshall Franklin.
Hi, it's Marshall Franklin with the City of Phoenix on the line, Human Services Department. Thank you.
Hi, thank you so much, Marshall. Do we have Tad Gary?
Okay, there we go. I announced myself, so I'm good. So yeah, so Tamara, it's more so again.
Marshall, can you put yourself on mute?
It's showing I'm on mute. It's not on mute?
No.
Is it on?
If you just muted yourself now we can't hear you. Okay, and then Tad Gary, I think, is he on still, or was his term up? I thought maybe his term was up, but anyway, Samantha Jackson, are you on? Okay, Bruce Liggett.
I'm here. I'm sorry, I couldn't unmute.
Okay, thank you, Samantha.
Samantha Jackson, Senior Director of Strategy and Community Affairs, Downtown Phoenix Partnership.
Thank you so much. Bruce Liggett. Joan Service.
Hi, Joan Service. Looks like Bruce, just so you know, is connecting to audio, and Ryan is also there too, just FYI.
Thank you so much. All right, Charles Sullivan.
Charles Sullivan, ABC Housing.
Thank you. And Jackie Taylor.
Hi, Jackie Taylor, Save the Family.
Hi, Jackie.
Hi.
Okay, one more time for Ryan Balch.
Sorry about that. I'm here. I'm working on some audio issues as well.
No worries, thank you.
Okay.
Liz DaCosta. Bruce Liggett.
Bruce Liggett is here.
Hi, Bruce. Thank you. Okay, I will move on to COC MAG staff and ask them to introduce themselves, starting with Steve Dudasik.
Steve, you're on mute.
Hi, everyone. This is Steve Dudasik from MAG, Human Services Planner 2. And Tamara, just to your point, Tad Gary is still on the board. He extended.
Oh, perfect.
So he's still with us.
Oh, great. That's great. Thank you.
Anyway, hi, everyone.
And Sapna Gupta.
Hi, everybody. Sapna Gupta with the Maricopa Association of Governments.
Thank you. Sarah Kent.
Good afternoon, everyone. Sarah Kent is here.
Thank you. Tina Lopez.
Hi, everyone. This is Tina. Welcome.
Hi. Brandy Mead.
Hi, this is Brandy Mead, Human Services Director at MAG. Nice to see everyone.
Nice to see you. Julie Montoya.
Good afternoon, everyone. Julie Montoya here with MAG.
Thank you. And Amy St. Peter.
Hi, this is Amy St. Peter, the Deputy Executive Director with MAG. Thank you for having me here.
Thank you very much. And we also have a few guest presenters today. When I call your name, please introduce yourself and your organization. Anubhav Bagley.
Hi there, I'm Anubhav Bagley with MAG, the Regional Analytics Director. Good to be here.
Thank you. Thank you for coming. And Amy Schwabenlinder.
Good afternoon.
Oh. All right. Thanks, Amy. I think we kind of lost you and you got echoey there for a second. Did I miss anyone? Okay, for all participants, Please mute your phone or computer when not speaking, and please do not put your phone on hold as this puts music into the call. And for all participants, we ask that you please identify yourself when speaking. We will also be reminding people to do that throughout the meeting, as we have been advised that this is very important for open meeting law. One final housekeeping item, all votes will be roll call votes, and I will call the roll after the motion is made.
Tamara, this is
Yes.
Jackie. I see Darlene Newsome on from you, Mom, as well. We missed her in the roll call.
Thank you. Darlene, would you mind introducing yourself and your organization?
Yes, Darlene Newsome from UMOM. Thank you, Jackie. I'm not presenting today. I'm just going to comment on item 4. So good to see you all.
Perfect. Thank you. Thank you, Jackie. All right, we'll move on to item number 2, a call to the audience. So please note that members of the public were given opportunity to submit written comments relating to this meeting to azmag.gov/comment within 1 hour of the posted start time for the meeting. Steve, were there any comments received?
There was one written comment received for item 6, which will be read during that presentation or after that presentation.
Thank you very much. Additionally, members of the public are now given the opportunity to ask to join the Zoom link to make verbal comment. So please note that verbal comments will be limited to 3 minutes. We received requests for verbal comment on the consent agenda item 3B and agenda item 4, and these comments will be heard prior to action, like specifically item 3B and after board comments on item 4. So we'll go ahead and move to item 3, the approval of the consent agenda. So as a reminder, please note that board members may request that an item be removed from the consent agenda if there was a need for discussion. Board members cannot comment on a consent agenda item without first requesting it be moved to discussion. Are there any requests to remove a consent agenda item?
Tamara, this is Bruce. Based on the language in item 3B, it sounds like the board is being asked to consider the capacity of HMIS and that people are available to explain. So it seems to me that that may be an item we want to take off the approval here and just have a discussion about that if needed. I just think that should not be on consent.
Okay, great. We'll go ahead and move 3B and hear that towards the end of the agenda, maybe around item 7, I believe, like right after Sarah's pit count comment or presentation. And we'll discuss that.
Thank you.
Of course. Okay, we'll go ahead and move forward with item 4. An update on the regional collaborative.
Madam Chair, I'm sorry, just a point of order. The board would still need to take action on the remaining items from the consent agenda, please.
Oh, I'm sorry.
So items 3A and then anything coming after 3B. Thank you.
Thank you. Coming back from Thanksgiving, I'm just like not with the program. Thank you so much. Okay, so let's go ahead and move on to approve the other items on the consent agenda. Do I have a motion to approve the consent items without item 3B?
This is Charles. I move to accept the consent agenda.
Thank you very much. Do I have a second?
I'll second Samantha Jackson.
Thank you so much. I will proceed with roll call. Ryan Balch.
Aye.
Thank you. Eric Cole.
I'm an aye, but I have a suggestion related to item 3C. So I can come back to that after the vote, if that's okay.
Okay. Liz DaCosta.
Aye.
Thank you. Marshall Franklin.
Aye.
Thank you. Samantha Jackson.
Aye.
Bruce Liggett.
Aye.
Joan Service.
Aye.
Charles Sullivan.
Aye.
Jackie Taylor.
Aye.
And I am an aye as well. This is Tamara Wright, and the motion passes. Thank you. Okay, now we move on to item 4.
Oh, can I just make a quick comment, Madam Chair? I'm sorry.
Yes, of course. Go
All
ahead.
right, thanks. As I look at, and I didn't want to pull it off consent because I didn't want to belabor the conversations. I'm appreciative of the strategy piece and the recruitment timeline. I would just suggest, it looks like in December, we'll meet and talk about our topics and set an agenda for the strategy session. I also wondered if, I don't want to add work to the staff, but if some sort of a survey or some sort of a questionnaire or something could go to board members ahead of time, so that we have something to kind of, react to going into that conversation. So I just make a, casual request regarding that. Can be taken or left, either one.
All right, thank you very much. All right, now we move on to item 4, which is a update on the Regional Collaborative on Homelessness. Amy St. Peter, Deputy Executive Director at MAG, will provide an update on the Regional Collaborative on Homelessness. Amy?
Great. Thank you so much, Madam Chair and members of the board, for this opportunity to give you an update. It is our absolute priority to fully engage you in these efforts, and we want to make sure that you have an opportunity to help shape this work. The Regional Collaborative is just that. It's a group of stakeholders, of different leaders throughout the community who are each bringing their own specific circles of influence, their areas of expertise, and their different roles that they play within the community together to really enhance that regional approach to homelessness, that regional that shared responsibility that we have in addressing this in a really holistic way. And so each of our communities have been facing the increase in homelessness, the decrease in affordable housing, the impending wave of people becoming homeless for the first time, possibly when the evictions are allowed to proceed in mass, and they have not been to date. So we're seeing a number of different reasons and catalysts really for this work, for this enhanced regional effort. And so we want to make sure that we're engaging you fully as the board, because you're the leaders, the experts in this area, and we really value your input with this. In particular, just to provide an update, the collaborative continues to meet on a weekly basis, and we are continuing to take a look at what are the strategies, what are the resources, what is the capacity needing to be built to really enhance the ability of the full region to respond to homelessness. And so there are a few different things that we wanted to be sure to get your input on. One of those, as we take a look at the data that we have, data absolutely drives this dialogue. And we want to make sure that we're making the decisions and choices based on really quality data. And so as we're looking at the data, that begs the question, what are the key questions that we're trying to answer right now? What is the data that's needed to answer those questions? And so we'd love to get your thoughts on that, either now during the meeting or anytime after the meeting. What are the key questions that you're needing to solve, that you're needing to answer within your individual line of work, and that can really help us with these regional efforts? So that's one area. So what are the key questions to answer? What's the data needed to answer those questions? We're starting to compile data right now through the collaborative, through the efforts at MAG as well. A little bit later on in this presentation, you'll hear a great report from Anubhav and from Sarah, really regarding the recent trends in housing and how those eviction rates really contribute to homelessness. So we're bringing our data to bear at MAG to help with those questions. Through the collective and with their support, we've also just launched a study on best practices in regional approaches to homelessness, and I'll ask Sapna to talk about that in just a moment. The consultant has been selected, and we are working on that contract that will be underway. So Sapna, I'm sorry I didn't give you much notice on that, but if you don't mind just jumping in and giving a bit more about the scope on that and what we hope to achieve through that study.
Yes, of course. Thank you, Amy. So regarding the study on best practices, regional best practices, we will be bringing on a consultant to examine what regions that have above 1 million in regional population, what approaches they have used to end homelessness. And the specific ways that we're looking at it is, what are the different strategies that they've utilized and how have they worked? So it's not looking at just, this is the plan they utilize and this is what's working, but within those plans, what are the elements that have worked? What are the short-term solutions? What are their costs? What are the medium-term approaches and the associated costs, as well as what is a long-term approaches and their associated costs? And the goal for us to look at these best practices is to inform our own approach and develop an understanding at what kind of solutions that other regions have employed and how might they be applicable to the Maricopa region, but specifically for certain elements such as diversion programs. What are the elements that have worked? What were the obstacles? How were they over, and how might they apply to the region? So the approach is going to be both holistic, but specifically looking at the elements and how they might apply to specific types of populations. The other element of this best practices is also looking at how have different regions around the region, how in the country, how have they looked at populations that were not initially part of traditional outreach when doing this program. And so I think it's really important now to make sure that we are responding to both the changing demographics, the urgency of the situation, but also looking at the equity and inclusion lens. And so there's going to be both outreach as well as outcomes, and how have they translated in terms of short-term, medium-term, and long-term solutions.
Excellent. Thank you very much, Sapna. So that's one example of efforts that we have underway right now to build capacity. We're building the capacity within MAG with our regional stakeholders, but also in really engendering a sense of that this is a shared responsibility and that it's regional in nature. It's not up to any one community and not up to a few communities. We need every community really coming to the table in this dialogue. So to that end, we did present to Management Committee earlier this month. It's still November for one more day, and we'll be presenting to Regional Council actually this Wednesday. I'm really engaging all of the cities, towns, and counties in this dialogue, really to be able to develop a suite of strategies that each community can really engage in. And so to offer that range of different kinds of strategies, ones that are empirically based, data-driven, so that every community has a role to play in ending homelessness right now. So we'll be going to Regional Council with that message in just a few days. We are working with our partners to develop what some of those strategies might be. And that's a second area where we would love to have your input. So the first is the key questions and the data. The second is, what are the strategies that we should be offering to the region that we can start to work building that community support and that political will to then implement. And so many thanks to Joan Service through the coalition. She's been helping to start to detail out what are those strategies around rental assistance, for example. And so different partners will play leadership roles in different areas. And so the coalition is built for advocacy. They do a tremendous job of it. They'll be leading efforts in that area. But together, we're wanting to develop that suite of strategies and that we can offer to the community. And we'd love to get your input. What are your priorities? What should be reflected in that suite of strategies? And we'd love to get your input then so we can include that. And then when we move forward with these strategies in the beginning of 2021, your interests, your priorities, your preferences will be included in that. So that's the second area. The third area is on outreach. Outreach is critically important. Right now with the collaborative, we are including just the regional players and just the regional leaders right now in this work. So the individual efforts, say at the city and town level, are critically important. But they're not at the table necessarily in terms of this collaborative. We need to engage them fully and wholly. And so we want to make sure that we have very targeted outreach to make sure that we're including a diversity of different perspectives in this work to make sure that the regional plan, the regional strategies are responsive and relevant at that local level as well. So we'd love to get your input on what are the stakeholders that we need to be engaging through outreach. So it's the cities and towns, it's the nonprofit agencies, it's the direct service providers, it's the faith-based community. So we'd love to get your thoughts on, one, who to include, and secondly, what is the best way to include them? We want the outreach method to be relevant to the stakeholders that we're trying to engage as well. Now, some of you on this board are actually members of that collaborative as well, and so there's a direct link. We see this work as being really hand in glove, and so whatever we're doing through the board, through the collaborative, we want those efforts to be aligned, and that's why we need your feedback here today and in the months to come as we start looking at implementing the strategies that will move people from homelessness to homes of their own. So I'd like to pause for a moment and see if you have any questions, any ideas, any comments. Again, those 3 areas, what are the key questions that we're trying to solve? What are the strategies that we should be offering to the region? And then in terms of the outreach, who should we be engaging in that? And can you help us to identify the most preferred method to reach out to them? So I'd love to pause right now and see if you have any questions or comments.
Thank you, Amy. Are there any comments from the board?
This is Jackie. I'm not quite sure how to phrase this comment. We've gone through, in my opinion, a really distinct, you're talking about how do we get feedback from people. We've gone through, in my perception, a really interesting morphing in this board of, it seems to me, taking very definitive steps to cut out public comment or provider comment, unless, those of us who are on the board. And I guess it would be helpful at some point, and not appropriate in this meeting, to learn how that change occurred, what the process was. So I think we missed out on a significant opportunity for community and provider input, the more restrictive we get in affording the opportunity for input in these meetings. So I do think it's critically important. When I looked at the list of key stakeholders on this committee, it's definitely absent of provider representation. I really believe that's vital. And I think as we're considering who those representatives are, we need to be considering the different populations within the homeless population itself, families, singles, veterans, those kinds of segments.
Madam Chair, Jackie Taylor, thank you very much for sharing that concern. We absolutely share that priority of fully engaging the public. I think we might have view it a bit differently. We are absolutely wanting to include public comment in these meetings. We allow the opportunity for people to come and speak verbally during the meeting. We allow the opportunity to provide those written comments. MAG is not holding any in-person meetings right now. You'll notice I'm in my office. That's rare. The majority of MAG staff are mandated to work from home still. And so that's why we aren't able to have those in-person meetings right now. It's out of concern for your safety and for your health and for your well-being. But we encourage actively any additional thoughts about how best to engage members of the public. We absolutely agree that provider perspectives are incredibly important. I used to work at that provider level for years, and so I've seen firsthand the expertise that you bring to the table. So if you have ideas for how additionally we can provide those opportunities, please feel free to share those at any time. That applies to not just the board meetings, but to any other efforts that we're engaged in as well.
Thank you, Amy. Any other questions or comments?
Tamara, Jackie, I want to make sure I didn't miss what you were saying, because your introductory kind of comment was kind of like a perception about the COC board and providers, and that this might be, that perception could be connected to this step. So you think that's out there? Do you think that the COC, that we as a board are being perceived as not being open to providers? Or did I mishear you?
No, I think you heard my concern very clearly. I don't think it's just providers. I think it's other community members as well that are being excluded. And believe me, Amy, you see, I'm sitting in my home office as well. I understand the limitations of Zoom meetings and all of that. But the very, we've morphed, we've changed processes without, as a board, really discussing why we've made those decisions for change. going from people outside community or providers that aren't on the board only being able to tune in by YouTube, I believe it is, or providing a highly structured process to want to weigh in on any one item, which creates difficulties because often you don't know how to weigh in on an item until it's been fleshed out more fully in the context of the board meeting itself. So I personally feel like, and I think I've attended every meeting, so I don't think I've been left out of anything, but I don't feel like I've been brought along in this process. It's all of a sudden, the process is just laid out there for us to follow. And I just feel very strongly about voicing those concerns.
No, thank you for that, Jackie. I really appreciate you bringing that into the dialogue. I think it's really important to be able to hear from everybody what their concerns are, what their preferences are, what their priorities are. We absolutely want to address that. We'd be happy to meet with you offline as well to go over any other concerns that you might have and to really thoroughly go into it. I can tell you that as MAG had to very quickly transition to a virtual environment, that we had to create new processes that we haven't had before. And we did so, and we've been continuing to refine those. I can tell you that with the board, with being able to have members come in and directly provide comment themselves, that's not afforded to any other MAG committee. We thought that was critically important for this board to have that opportunity because we understand how critically important it is to provide that direct feedback to the process. So no other committee at MAG has that opportunity, only this one. And we made that decision proactively, not at anybody's request, but proactively to ensure that providers had and other stakeholders have as much opportunity as possible to be able to participate. The reason for the public participating by the streaming video is because a number of people throughout the country, have had to struggle with Zoom bombing, with people coming in and disrupting the entire meeting. And we wanted to ensure that your meetings could proceed as planned and in a professional way and in an inclusive way. And so that's why members of the public view by streaming versus being able just to post this Zoom meeting link on the website for everybody. We were concerned that would expose you to unnecessary distractions and interruptions. But if there's other ways that we can refine this, please do let us know. We'd be happy to hear those and happy to meet with you one-on-one after the meeting as well. But thank you. Thank you for bringing that to our attention. To segue, it's critically important for us as well, not just to engage our stakeholders in these board meetings, but also through the activities of the regional collaborative. And so if you have ideas for how best we can engage folks, it's important to hear from a diverse cross-section of the community, and whether that's asking to be placed on the agenda or be part of another group's discussion, or whether it's having a separate Zoom meeting or meeting through any other kind of virtual platform. We really want to do that. The feedback is critical to receive, and we want to make sure that we're bringing all voices into this conversation.
Madam Chair, Amy, can I?
Yeah. Oh, sorry.
So just, I think some things are being a little conflated. And so first, I think Jackie, to your point about public comment during the MAG meeting itself, I think that there's some kinks that need to be, I think we can, both the board and MAG and the public can work towards striving to get that right mix. Because I respect what you're saying, Amy, that you're trying to make sure that we're not exposed to the Zoom bombing that occurred at this onset of the pandemic. But at the same time, is there ways, and thank you again for making that available for the COC board, but I still think that maybe we can even take it one step further. I don't, unfortunately, know. I know that MAG has the infrastructure, the IT set up to possibly explore what ways to better engage the public, because again, I do think that that's critical. And I do, I do want to make sure that public comment is as involved as we can create a virtual environment. So, I want Jackie, just as a fellow board member, I want to say I validate that concern as well. But I think also what might be getting confused is this whole discussion of agenda item number 4, the regional collaborative on homelessness, because there is, based on the membership, there is not a provider voice. It will be provider, I think we had a conversation about this, provider informed.
Mm-hmm.
Yeah. So I want to be really, and maybe you're going to get into this, Amy, and I apologize if I'm stealing your thunder, but I want everyone else to feel assured, at least to my extent of knowledge, that it will be definitely provider informed and encouraged and informed and collaborative with all necessary partners, all not necessary, but important partners. So I just want to make sure that, one thing is around the COC board itself and the other is around the regional collaboration. So let's just make sure that we're real clear. We know that the COC board meetings, I think we all just need to strive to increase that communication. And around the regional collaborative, again, not trying to steal your thunder, but we're more communication we're working on that. So
yes,
with that, Amy, go ahead.
No, Joan, thanks so much. And we are just forming, and so we are putting together who are the key stakeholders, how do we best reach out to them, how do we make sure that these efforts are informed by the providers, by others in the community, with the cities, towns, and so putting together that outreach plan, I think, will be really critically important because it really does take a multitude of diverse perspectives to create holistic, relevant, responsive strategies. So that will absolutely be a cornerstone and one of the principles for this work moving forward.
Madam Chair, can I ask a question?
Absolutely, go ahead.
I really appreciate Joan commenting, because I think we're fortunate in the way the regional collaborative is structured to have board members that are a part of it, and I appreciate the more you all can liaise for us and communicate back to us. That's great. But I do have a question that may not be answered yet. And I am all for dropping silos. I completely agree with what you said, Amy, about holistic, responses. We know though that bureaucracies have a whole lot of pieces, right? And they don't always talk well to each other. So I get that intent, but I guess where I'm kind of stuck is with the regional collaborative. I mean, ultimately, who will ratify it? I mean, is it the MAG board? Is it coming back to us? I mean, one of the things we struggle with in homelessness is, who's in charge, right? So I wonder if the collaborative hasn't thought about that or talked about it yet. I think it's a pretty important question, because knowing that answer might provide some more, trust and participation in the process.
Madam Chair, Eric, that's a great point, and we have been asked that. So on one hand, thanks. So that is a really critical question, and it's really important to come together as a collaborative and to recognize that each entity brings its own skill sets to the table. But at the end of the day, who's going to bring it across the finish line? And it's the collaborative. But who approves that? How does a collaborative fit within the existing structure? Who does a collaborative answer to? Those are all really critical questions, and we are having those same discussions right now with the partners involved in the collaborative. And so we are currently working on a document to help to provide clarity around that. And so I appreciate that priority, and that is absolutely a valid question, a critical one, and one that we are in the process of answering right now.
Thanks. And part of what drives me to that question was research and work I did in my previous community. I was not nearly as technical, I think, or as sophisticated as what you all are about to do around best practices modeling. I do have some of that stuff if it's helpful to the team. But the convener, the where the entity sat, if you had major political support or not, all of those things really mattered in my view in the success of the community. So anyway, that sounds good. Thanks.
No, thanks so much. We have been hearing those same questions from others. So you're definitely good company there, and we'll be providing clarity around that very soon. We have ideas, but I don't want to get ahead of the other group members. So we'll be coming forward with additional details on that very soon. Thank you.
Thank you. Were there any other comments from the board?
Madam Chair, I think Ryan was trying to talk, but she was having some issues with echoes.
Thank you for letting us know, David.
Ryan, are you able to talk? Oh, she's connecting to audio.
Yeah.
Okay. We'll wait for you.
All right. Can you hear me now?
Oh, yes, but you do have an echo.
Hey, Ryan,
can you hear me now?
Yes.
Yes.
Yes. Okay. There's all kinds of issues going on here today. So I just wanted to, thanks Amy for your report, and thanks Madam Chair for taking all of these comments. I wanted to maybe add a little bit to what Joan was saying in terms of my understanding of what's going on, and my personal concerns, or maybe a little bit of uncertainty. I feel like we are being asked as a board to quasi sign off on, approve, condone, bless this collaborative process. But it feels very awkward to me personally as a board member to not at all understand this collaborative process, or know where it came from or how it came about, or not have the regional governing board that, you know, does its best to make sure that people experiencing homelessness across this region are served, that our services are connected, that we are keeping an eye on best practice, you know, across the country, that we're being innovative, and that we're, you know, being responsive to the specific needs of our specific region. So this board comes together and we dedicate our time and energy to trying, you know, along with all of our colleagues who just don't happen to be sitting on the board at this very second. So we're just representatives of all of those people for this moment in time, right? And so as a board member, I feel that responsibility of, you know, doing my time to represent this community. And I feel like this collaboration came from somewhere else. I don't know. It feels like an outside entity to me. I don't know what it is. It doesn't. I don't know anyone on the board who, or at least I haven't spoken to anyone on the board who really has like a better idea of what it is. And so it feels real awkward for me to be sitting on this board and to be having this other thing happening aside the board, but the board is not driving it, or even, in my personal feeling at the moment, even actually being involved in it. But we're being asked to change our recruitment strategy, sign off on a consent agenda on a new member recruitment timeline. And I just don't know where these things are coming from. We haven't discussed them as a board. You've given us, I think, as much detail as you can, like you kind of iterated earlier, without getting ahead of whatever group this is, but I don't feel involved. And I'm pretty uncomfortable signing off on these votes. It feels like something that's driving alongside us, not driving with us. And so I'm not sure how else better to state it than that. I'm very thankful and appreciative that whatever it is happening is happening. But I want to make sure that this group that is right now appointed to represent all of our colleagues who are out there doing the hard work are part of it, and making sure that we actually are representing them. And I can't even explain it to them right now. So I'm uncomfortable.
No, thank you.
But not appreciative, but uncomfortable.
Right. No, I hear you. And Ryan, thanks so much. I really appreciate it. I'm eager to hear your perspectives on this, and I think it's very constructive to be able to bring those concerns into the meeting and to the table, rather than keeping them to yourself and then still feeling uncomfortable. So I think it's great, because this gives us an opportunity to acknowledge those concerns, to validate them, and then to be able to talk through them. So really appreciate that. I'd love to help with some of that uncertainty in terms of how this is coming together. And I appreciate that it feels uncomfortable and that it feels very uncertain, and just not knowing kind of where it's going, it can be very, very disconcerting. So I really want to acknowledge that. We are working on a document and really starting to flesh out how we're working together. And I really do want to emphasize that the collaborative is just that. It's not meant to take the place of the Continuum of Care Board. It's meant to support your efforts. That's why I'm here today asking asking for your feedback around the strategies, around the outreach, around the data, around those key questions, because I want to make sure that as this group comes together to support efforts that are underway in terms of ending homelessness, then we can make sure that we're aligning with you, that we're not competing with you, and we can't take the place of you. So this really is meant to bring some stakeholders together who have some common interests, and see how we can support each other in our areas of work. So in terms of how it came about from different regional efforts, either being underway already or just launching and realizing, well, we aren't talking to each other, we aren't leveraging each other as much as we can, so why don't we come together and work together? And literally, we've been meeting weekly, but it's been maybe a month or two. I mean, it's all very new, so you really haven't missed much. You know, there's not a lot of history behind the group that's just coming to light. You know, we came to you right away to let you know that these stakeholders are coming together to have this conversation and to be sure, hopefully, to really fully engage you in these efforts. So in terms of where it's going, and we respect and we value the role of the Continuum of Care Board, and in terms of the delay on the new member recruitment, that had nothing to do with the regional collaborative. That really came out of a growing recognition that that we have a need for the board to be more actively engaged in policy, and you've certainly been engaged in policy on different levels. You've got tremendous expertise in terms of the operations as well, and the operational work takes a lot of time and a lot of focus. We've been hearing and seeing that we see an even greater role for the board in terms of policy, and so we had the conversation about how do we fully equip the board to be able to further engage in that space. So I can see where there'd be confusion between the collaborative and the new member recruitment, because we talked to you about those in the same month, but the new member recruitment was adjusted in terms of the timeline and the focus because of the region wanting the board to take a more active role in those policy discussions. The collaborative doesn't inform, doesn't shape the membership or the strategic planning of the board. Those are separate efforts. We hope through the collaborative to be able to support the board in your strategic plan and to align with it. But the collaborative would not presume to set a timeline for the board in that regard. So and I understand that it's uncertain. We're still working to answer some of the questions that have been raised just even within this meeting. But all of the discussions are really coming out of a fierce desire and commitment to working together, leveraging each other, and to be able to align with each other in terms of how best do we move this conversation forward. We're hearing from the communities that they're facing huge increases in homelessness, and we see the data through the street count and through other sources, and people are really wanting solutions right now, and we hope to help answer what some of those solutions could be, but we aren't taking the place of any one entity in this work. We hope to support the entities in the work. So, and hopefully we'll have more answers to come, and we'll be working very closely with you. It was very important to have this item on the agenda today, because we want to make sure that we're fully working with the board, and that we're including you in these discussions as they move forward.
I appreciate that, Amy. One last question. Is MAG facilitating the collaborative?
We are a member of the collaborative. In our weekly meetings, I have been helping to facilitate those meetings. That's one of the questions right now before the members, though, is to because we have talked about this in terms of this is a collaborative, and so we're equal partners in this work. One of the questions is should MAG be in that leadership role within the collaborative, and so those discussions are underway.
I guess one suggestion I might have, you were asking about how to make sure everybody's included.
Yeah.
Perhaps the chair of or an appointed member, however, some representative of the Continuum of Care also be a member of this collaborative so that there is a cross sharing and understanding and sort of no one gets left behind.
Absolutely. Thanks for that, Ryan. I do just want to point out, in case it's not apparent, Joan does serve on the collaborative as well, and Maricopa County serves on the collaborative. So we do have 2 existing board members who are members of the collaborative, and so we hope that partnership, that linkage will provide a good conduit between the collaborative and the Continuum of Care board. And that's in addition to the MAG staff who are also participating. But I do think it's very important for the board to have that representation, and they do right now through those 2 members.
Thank you.
Thank you.
Amy, it's Marshall. Can you hear me?
Yes. Hi, Marshall.
Okay, good. Hello, everyone. So just my quick question on this. I would agree with what everyone has said in terms of increased opportunities to make sure it's real clear about the mission, the focus, what is the end game. The only question I have, and I've been asked this question since this has been discussed, at least within the city of Phoenix, is who determined who were the collaborative members? Was the one question that I've been asked. And I said I will find that out. I knew this was an agenda item. And then secondly, probably more a comment that I do think it's important that at some point in time, it's real clear who has to lead. It's nice to have a collaborative, but somebody's got to kind of own how we move forward the collective of the collaborative. So I'm hoping that quickly and sooner rather than later, that piece of the puzzle can be answered. So thank you.
No, thank you very much, Marshall. Really appreciate that question. Our next collaborative meeting is on Friday, and we're addressing this question. So we hope to have an answer for you at least by the end of this week. And we do have that dialogue that's been started already. And so we hope to resolve that very soon. We are working on that document to clarify the very questions that you've been asking. So I do think that's important. To answer your question very directly, though, in terms of who chose the membership of this group, we weren't appointed. It was more regional groups who are active in this space coming together and reaching out to each other. And so right now, those are the 6 entities. It's MAG, it's Maricopa County, it's the Coalition, it's ASU, it's Vilas Health Foundation, and the United Way. And so there's some natural affinities there because we're all regional players and we're all addressing homelessness in some formal way. And we've talked among the 6 entities, well, how do we bring on new members? And so we had agreed that we would talk with each other if there was a request to add a new member, that we would talk among the 6 entities, and then collectively be able to agree on yes, that's a great fit. There has been some diligence around making sure that the partners are regional, and so they don't represent necessarily any one community or any one population, but like youth or vets or older adults, because we really want to make sure to the fullest extent possible that regional aspect is really held firm. Because we really need more regional ownership of this issue. And so we want to make sure that the strategies really are aimed at that regional level, understanding that those local efforts are critically important and valid, and the providers and the people who represent certain populations within homelessness are critically important as well. And there's certainly enough work to go around. So there's a space for each of these different efforts. We were carving out a space for those regional efforts, if that makes sense.
No, it doesn't. Thank you for that. The one suggestion I'd have is there's probably opportunity for whomever eventually is going to lead this or for the collaborative as a whole to be very clear about the genesis, why it came together, who was selected, you know, the fact that you mentioned about we want to keep it high level, regional, thus there may have been X, Y, or Z that wasn't included, you know, what we're trying to solve for. I think there's opportunity to ensure that message is framed appropriately.
Yes.
Because quite honestly, I think folks are formulating their thoughts and opinions about this based upon what they know or don't know.
Right.
And I'd hate for this to get derailed because there was an opportunity to clearly articulate intention and focus and goals at the end of the day.
No, thank you so much. I think that's an excellent point. Whenever there's a void, it's human nature to fill it. And so it sounds like that's already started. And so we want to really be able to answer that very clearly, very, very transparently. So we really appreciate you bringing that forward. Thanks, Marshall.
Thank you, Marshall. And I do want to get to the public comment and then move us on, but I did just want to say that I would hope that we wouldn't make any decisions of who's going to lead this next week, because we're going to be recruiting new board members and be a more of a leadership active policy board that should be leading the regional approach. And so I wouldn't want other agencies to take the lead on the regional approach when really that's the purview of the Continuum of Care board. And so my feedback would be to just hold off on who's going to be the lead on this until we figure out our new board members and our board strategy going forward.
Thank you very much, Madam Chair. And I really do appreciate everyone's comments today. And we'll absolutely continue this dialogue with you and really look forward to partnering very closely with you throughout these efforts.
So much. And then we did have one public comment from Miss Darlene Newsom from UMOM. Darlene, are you still on?
Yes, I am. Thank you very much. Good to see you all. I do have a couple comments, you know, because I've been around a long time and we've had a lot of regional plans, you know, and I think with this regional plan, you've got to have some wins. You know, you've got to have some kind of short-term pilot. You got to go in and something has to happen because the numbers are increasing. And for somebody who's been working regionally for many, many years, because many providers serve the region and we work with all the different government entities and we have those relationships. Also with coordinated entry, I really do believe the 2 coordinated entry providers need to be included since we are a regional coordinated intake site. We already do a lot of diversions. In fact, we're probably one of the top diversionary family providers in the country with our diversion efforts. We do gather best practices. We do visit other programs nationwide. We have a lot of information. I just don't want that to be forgotten in this whole thing. And in listening to the comments, I agree with most of the comments. I'm not sure, I know the city of Phoenix has a regional, has their strategic plan that includes a regional. So I would hope that the city of Phoenix at some point would be at the table. They should be at the table. They're a major player and they're a major funder. And I just want to see some action. That's all I want, because I go to all the cities, we all request money. Everybody asks us, how many people do you serve from our city? We have all of that data. We have much more data than even HMIS has because, many providers have their own parallel system to collect data and different types of data and outcomes. I just don't want that to be overlooked. I mean, I'm not very patient for meetings after meetings and pulling people together because action needs to happen. I mean, there's people out there who are homeless. You guys are smiling because you know me, but there's families out there that need help, and you have children who are homeless on the street. You have youth who are homeless on the street. You have the family tsunami that's probably going to happen when this eviction moratorium is lifted. And so action is really important. And I think action speaks so much louder than words. And I've been involved in a lot of regional plans. We have a lot of regional plans already in place. What happens to many of these plans is what happens to a lot of strategic plans. They're developed and they all look good, but nothing actually happens. And I just ask that this committee take a few steps further. And if it's a pilot that needs to happen between maybe 2 or 3 different cities with intergovernmental agreements, just to get something lifted off the ground, I think would be very important. Even though I'm retiring at the end of December, I'm not going anywhere. I'd like to be involved at some level just because of the relationships that I have, not only with the government agencies, but the faith-based communities and some of the major foundations, and especially family foundations in the community that are very interested in this area need to be at the table. Those are my comments.
Thank you. Thank you, Darlene. Really good to hear from you. And we share that same urgency around wanting to see action, and we are very committed to that as well. So really totally agree with you. I think we're all very invested in that outcome. Thank you.
All right, thank you.
You, Darlene. I love the building, the snowball effect, right? Having some small wins to build that momentum and get things really going. I agree with that. Was somebody else going to say something?
I was just going to ask a quick question. I mean, it sounded, looking at the agenda, and then Amy, clearly as you started talking, that I'm cognizant that what we've talked to you about is process. We've not given you substantive, suggestions about the content. And I mean, we could do that. I think we'd be here for 3 hours if we did. So I just, from my perspective on the content, I think we have a lot of good feedback we've gotten in various places over the last couple of years. The focus strategies work. The racial equity work is phenomenal from what I can tell. I also know our committees are, phenomenal and deep thinkers, far more than certainly I am. So, I mean, I can give you my sense of what's needed, but I think what I would most encourage is just that the time is taken to get that input, either from what we've already collected or from the committees themselves. Because I think in so many ways we know what we need to do. We're just not organized in the right ways to make it happen.
No, thanks so much, Eric. I think that's a great point. It's been said before too that we know it needs to be done. We need to build the community support and the political will to do it. And so I think that's a great point. I really appreciate circling back to those 3 areas with the key questions, the strategies, and then the outreach. I know we've talked a lot about the outreach. That's critically important. If folks have additional feedback, concerns, questions, please feel free to reach out to us at any time. We really appreciate your feedback on all of these questions. We recognize that there are voids because we're just developing and that we'll be filling those voids, but people have already started doing that. So we need to really jump in and be able to communicate these areas and be able to clarify those. So we will absolutely take a look at what's already been developed. If folks have additional feedback beyond those resources, please feel free to reach out at any time. Thank you.
Thank you so much. And with time in mind, I'm going to go ahead and move us on to the next agenda item, which is number 5, emerging housing trends. Oh, wait, no, are we on item 5? Yeah, sorry. Yes, please. And I'm going to introduce Anubhav Bagley, MAG's Director of Analytics, and he's going to present data on the current regional economic and housing trends.
Thank you, Madam Chair. Thanks for having me, giving me the opportunity to share this information. I'm hoping everybody's seeing my screen. So I'll cover a couple of quick topics. A number of these you're already, I'm sure, all aware of and what's going on. But the big thing really is that the COVID-19 pandemic crisis has caused our unemployment rates to shoot up. We were at about 3.5% unemployment rate before the pandemic started. So in March, we had about 137,000 people who were unemployed in Phoenix MSA. At this time, actually, this number is lower. This number, 6.3%, was for September. October right now is 7.7% of our working age population of our labor force is unemployed. That is approximately just under 200,000 people, workers, are unemployed at this time. MAG staff has been collecting data, working in a partnership with Arizona Department of Economic Security. And we're getting statewide data on unemployment filings, and we're collecting data on the unemployment filings, which becomes these initial claims are precursors to what we see in terms of unemployment going forward. And what you're seeing here is a map of total claims for the month of October 20th to November 19th. Obviously, the darker colors are areas where there's higher unemployment claims. We have updated, we update this data every couple of weeks, and this is available on the website. That the link is there on the slide. I'm happy to share that with everybody as needed. With the big number really in the past month in our region, we've had unemployment claims being paid to about 106,500 some people. Since March 14th, it's been about 575,000 people. That's a large, staggering number. That's extremely concerning, given the fact that all the CARES dollars, et cetera, and any kind of stimulus money has dried up, and this time it's not coming in as soon. What's also very concerning is this fact that the low income, the low wage workers, the ones making less than $27,000 per year.
Sorry, your call cannot be completed at this.
Are the ones that have been the worst impacted. The high wage and the middle wage actually have kind of gone through the crisis. They were highly impacted, but it is the lower end of our economy, that lower wage workers that are still about 20% lower than what they were making in January this year. This is extremely concerning, given what's happening on the housing side of stuff. And this is directly related to all the work and everything else that I've been hearing. So MAG tracks data on housing sales. Housing sales prices, all of you know very well, are through the roof. They're one of the most hot markets in terms of housing pricing. The blue line here is showing you the median housing price for Maricopa County. The greenish line is more for Pinal County. In our region, we've seen a run up of about just under 17%. This time, the median housing price, buying a house listed on the MLS, is about $340,000 in this region. We are much higher than the US now. We used to be the green line on this chart is the Phoenix, Mesa, Scottsdale, NSA. We used to be in 2017 just under the US number in terms of the median housing price. We are now above the US by about $28,000, $30,000. And the blue line here is just a representation, just showing you what's going on in Western US. Now, Western US obviously includes California, Washington State, Oregon, etc. They are much higher than the Phoenix market. And with this current economic conditions that we have and people working from home, there is a large influx of people buying in more expensive homes and increasing the prices actually in the Phoenix market because they're moving in from California, et cetera. We've got data on that. Similar piece related to this really is the fact that this chart is showing you what is happening in terms of the pricing. In 2011, our market, just coming out of the housing crisis, we are primary about 75, 76% in 2011 of the homes being sold were under 200,000. In 2015, that was somewhere about the 45, 50% mark. 2020, that is less than 20%. Even housing units being sold for 300,000 or less used to be 300,000 used to be about 90% of our market. At this time, that's about 50%. This coupled with this next slide, which is showing you what's going on with the rental pricing, is extremely concerning because the rental pricing, if you look at 2010, just like Q4, quarter four of 2010, apartment rents, we had about 22, 23% of our inventory was under $500 per month, and more than 90% used to be under $1,000 per month. So 500 to 1,000 was the key number. At this time, now that under 1,000 is just about 31, 32%, and the under $500 mark is non-existent. And what you see on this chart is the darker, the numbers that are above $2,000 per month and the $1,500 to $2,000, which were really non-existent back in 2010. That luxury market has come in and is starting to press in. So this combines this map and combines the data on affordability. We're trying to identify where is our vulnerable population living. The map here is showing you households that are paying more than 30% of their household income for housing costs. 30% is usually the mark because you usually want to have about 70% for other expenses, health, food, education, etc. This darkest color in red, households, more than 45% of households in those areas are paying more than 30% for housing costs. Anything that is yellow, orange, and red are above 30%. So the total number of households in our region that is paying 30% or more is just under 500,000. 478,000 households are paying more than 30%. 212,000 households in our region are paying more than 50%. What's concerning is 90 to 95% of these households are income below the median household income of 60,000. But even what's more concerning is that 50% of these households in both these categories are single worker households. So talk about vulnerability with unemployment rates increasing. This becomes a major issue. We've discussed the possible impending crisis related to evictions. This chart is showing you the evictions data coming from Maricopa County Justice Courts. And what you're seeing is we were averaging at about 6,000 evictions per month till about February. March 24th, the first moratorium went into effect, that number dropped down, and we've been at about a quarter of that 6,000 number, 1,500 to 2,000, but that number is starting to pick up. September and October, the numbers have gone up quite a bit. What's very concerning is if you look at this map, the left map is showing you the evictions between January and December 2019. So last year, the 68,000 evictions that happened. Darker colors were the higher areas. The right map is showing you, the one on the right is showing you that those till October this year, just for 2020. These areas are very similar to the areas that are showing on the vulnerable populations. That is exactly the area where the evictions are happening. To reiterate that point, more than 77% of evictions are this year have been in areas in the lower income areas, in areas making less than $60,000 per year. Recently, 2 weeks ago, maybe just about 10 days ago, there was a report that came out done by the University of Arizona, National Low Income Housing Coalition, and Innovation for Justice. And they came up with a national analysis of number of households at risk for evictions. Arizona, and there are multiple methodologies they applied to that. Arizona, that number ranges from 121,000 to 274,000. The cost of that for Arizona is estimated at about $1.1 billion to $2.5 billion. That cost includes cost for emergency shelter, health, foster care, etc. I don't have a slide for this, but there is another data set that just came out, and this is the Census Bureau does a survey, has been doing a weekly survey after COVID started, and in looking at the housing impacts for week 18, which is the first week, the last week of October, first week of November, seeing that is basically getting about 20% of renters in Phoenix MSA are saying that they are not confident they'd be able to make a rent payment next month. That's 20% as compared to 11% for the US. Another 16% of renters are saying that they are significantly, they're not confident that they'll be able to make rent payments next month. The final piece of data I'd like to share is from that same survey, about 73% of those renters said that they were very likely to be evicted in the next 2 months. And this is about 25% higher than the US average. So those are kind of the grim numbers I wanted to share. Madam Chair, members of the board, I'm happy to provide more analysis or data as needed. I'm happy to take any questions.
Thank you so much. Do we have any questions from board members? I did have just one quick question. I saw that the public costs were for Arizona were 1.1 billion to 2.5 billion for eviction related homelessness. Do you know what kind of costs that's referring to?
Madam Chair, that basically include costs for emergency shelter, medical, whether an emergency medical or inpatient medical, foster care, juvenile delinquency. They basically use multiple methodologies to look at that and estimate what this cost would be. My team, they're working with a few of our member agencies, providing them ongoing data in terms of to help them in any kind of tenant assistance or landlord assistance programs to kind of, if there are programs that our member agencies are leading, then we are providing them a lot of data on that. So happy to discuss that.
Thank you.
Tamara?
Yes.
I always have 100 questions when I see data like that. Good data just makes me want to go more and more and more. I guess this is just a starting point. So, and as an example, you had an indicator of how many of the households were single worker households. My interest is how many of them have young children. And maybe you can get that. I guess, are we entertaining a process maybe if we have some questions? I'm not asking for answers now, but maybe I can look at it a little more closely and say, what are some key questions? Are we able to send those all in perhaps at a date certain, and you could prioritize what's doable, what's more important?
Madam Chair, Bruce, absolutely. We welcome any kind of questions because this is the whole idea to kind of start this discussion, see what data can we provide to help this process moving forward. As I mentioned, my team's putting together a similar set of data for Peoria, just for them to discuss with their council later this week to kind of take that forward and start understanding the details. So we could definitely add that question on how many of these have young children, etc. But if there's other questions, do definitely let me know.
Thank you.
So much. I feel like that eviction data, especially those numbers, are really interesting, especially considering Maricopa County has such a high eviction rate. And I wonder if there's a way to, I know there's a lot of entities working on some of the eviction work and trying to adjust some laws, but I would think that looking at that number and comparing it with what it would cost to do some sort of prevention and try to say that this would be a cost savings to not have such tenant, I'm trying to be political here, not have such laws that are very landlord centered, like have them be more tenant based and show the cost not only to people's well-being, but the public's dollars that are being spent because of this eviction problem that we have. I think that would be really powerful.
Absolutely, Madam Chair. And that's kind of what I indicated, that we're working with a few of our communities, providing them data on where are the parcels which are tenant, their landlords, who the landlords are, so that they could be contacted to provide them information about programs. Because the other data set we're seeing come in is landlords, particularly the ones with smaller properties, the ones that own less than 10 units, are having a lot of trouble now making payments on their side for their mortgages, etc. So it's have to start looking at this from a holistic perspective in terms of what are the impacts that are now trickling down the stream from the tenants to the landlords themselves too. But as these questions keep coming in, we're happy to kind of start looking at that data together on this stuff.
Madam Chair, if I could add.
Please.
I would just like to say that related to that, the Housing Coalition is leading two time-limited working groups around some eviction conversations. The first being a rental assistance advocacy working group, meeting with our congressional leaders and our state legislative leaders. So that's one. And so members of the coalition are absolutely invited to participate in that. And then the second is, as has been noted, any laws as it relates to eviction would need to go through the legislature. However, there is an administrative office of the courts, which basically provides some technical assistance and support to different jurisdictional courts. And so there's an opportunity to make some recommendations. That's the second time-limited working group that we are inviting coalition members to participate in. So just wanted to share that.
That's great, Joan. Thank you. Any other questions or comments from the board, or should we move on to the point in time count?
I just had one question or suggestion maybe is I've done, City of Tempe's done some great surveys of residents and like what we're running into, and I'm sure the other cities have too, what people are running into during the COVID crisis. I think that data, if there were a way to get a hold of it, would be really interesting because they usually ask, what specific bills are you struggling with? What are the specific issues you're having? That, it might give us a little more flavor than just, all these things are great. Cost burden is really important. Eviction number is really important, but it might give us some flavor, especially if part of our future work is going to be around diversion and prevention.
Mm-hmm. I say amen to that, Eric. This is Joan again. I would say if we want some qualitative information, I don't want to volunteer them up without their permission, but Crisis Response Network, a woman named Amina did an amazing job providing, the tenant voice during our eviction forum. And I know that they're collecting a lot of the stories and what the callers, the crisis and really the crisis, but also the struggles, and it really gives great voice to that. So if they're able to provide some qualitative information, I think that'd be hugely beneficial.
Okay, great, thank you. In the essence of time, I know we're running a little bit behind. I'm going to go ahead and move us on to item 6, if that's okay. And thank you so much, Anubhav Bagley, for your presentation. That was wonderful. All right, and so we'll move on to the 2021 point in time count. Sarah Kent from MAG will update the board on what the plans are for the 2021 pit count. Sarah?
Thank you, Madam Chairwoman and members of the Maricopa Regional Continuum of Care Board. As mentioned, my name is Sarah Kent, and today I'm here to talk to you about the 2021 point in time count. First of all, I want to talk about the ways that COC uses PIT data and address some common misconceptions and misinformation. The point in time count is only required by HUD every other year. HUD asks COCs to do a count so that they can have an accurate number, or I put that in quotes, as accurate as a snapshot can be, an accurate number of folks who are experiencing homelessness at any given point in time. The point in time count is only one small way that COCs share data with HUD. We understand that many municipalities use PIT count data for grant applications. So we want you to be aware of other ongoing data that the COC is already collecting. Our Continuum of Care has a real-time outreach viewer that's used to coordinate care between providers. When an outreach worker comes into contact with a person experiencing homelessness, the outreach worker enters XY coordinates into HMIS so that providers can see the last place the client was and what provider helps them. Providers can also filter out and see different subpopulations, such as who's a veteran or youth, chronic, etc. Our COC also receives a weekly shelter report from HMIS on data that covers emergency shelter, transitional housing, safe haven programs, including demographics and universal data elements. We also receive a monthly people count. Basically, it's a bed count report from HMIS that shows the increase and decrease in beds, or in this case, housing folks, due to COVID-19 funding, such as CARES Act, within the transitional housing, shelter, safe haven, PSH, or RRH, and hotel stays. The data that we have in-house is much more comprehensive than the PIT count data. Although I want to state that aside from COVID-19, we have full intentions of participating in PIT ongoing 2022 if the pandemic allows. We're also open to any ideas that you all have and providers have on other quality data that might be of interest to you. So HUD has provided some guidance on options for us on how we can choose to proceed as a COC with the 2021 point in time homeless count. Some of the options they have offered are, for one, doing the full PIC count, including the survey, or two, only counting folks via observation, or three, only doing the shelter count, or AKA also known as the HIC, or the housing inventory chart, which is essentially a shelter count. So the HIC is done using HMIS data, so there's no need for any volunteers. So HUD will allow COCs to request an exception to some or all of the unsheltered PIC count requirements. Maricopa Regional Continuum of Care, we have joined several meetings with other COCs around the nation, and it's clear that most COCs are very uncomfortable with putting staff and volunteers at risk of COVID-19. What we've learned from these meetings with other COCs in the nation is that the majority of the COCs are either opting out this year entirely, opting out of PIC count entirely, or using existing data that they will send to HUD. Many COCs are simply going to use their by name lists rather than doing a count. So that's quite interesting. So to answer some questions that you might be thinking right about now, would a waiver, sending a waiver to HUD, be a waiver on funding? And the answer is it wouldn't be a waiver on funding, but a waiver to opt out of doing solely the 2021 count. We use PIC count, we use PIT 2020 numbers. We can use PIT 2020 numbers if we need to. So as mentioned prior, COCs are only required to do a count every other year anyhow. You might also be wondering, is there enough data that that would support an increase in funding that PIT would not be needed? There is certainly enough data that would support an increase in funding. If we get a waiver to opt out of the point in time count for 2021, we can use the current data we have from our housing inventory chart HIC or other sources such as our inflow and outflow. We've got a Stella tool, the outreach viewer, the weekly shelter report, and on and on. And we can also cite the unsheltered 2020 PIT data to demonstrate an increase in numbers to make a case for more permanent supportive housing and rapid rehousing dollars. This would be for the NOFA for fiscal year 2022, not this year, because NOFA is always a year ahead in terms of the award. So based on the COVID-19 cases increasing dramatically in our region and the health and safety concerns among volunteers and staff being a huge risk and liability to the whole COC, based on the guidance we've also received from HUD, and given that we have more comprehensive data in-house that we can share with HUD as well as ongoing with our providers, our strong staff recommendation is that we will be sending in a waiver to HUD to opt out of the unsheltered point in time count for 2021. We are still able to do the housing inventory chart, also known as the shelter count, as HMIS can pull that data, because the health and safety of those who are experiencing homelessness, our staff, and almost the 1,000 volunteers that it would take is our biggest and number one concern. So I want to make clear that the data from the 2021 PIC count, along with supplemental data from 2021, can be used for our next NOFA submittal, and we won't be penalized at all by HUD. So with that, this item is not up for action, but we would like to hear your feedback, and thank you so much.
Yeah, this is Tad, Madam Chair. If I could ask a question.
Of course. Hi, Tad.
Great. Hello. Definitely hear a lot of the benefits of, doing something a little bit different, definitely this year. What are the risks in doing something different? I didn't really hear I just want to make sure we have our eyes wide open on this. It definitely sounds like it's a movement we probably, given the times we're living in, need to move forward on. But what are those true downside risks that we should be aware of as the board?
Madam Chairwoman, from HUD's point of view, there really isn't any risk, is what we're hearing as far as guidance, and that they've they've in a sense really encouraged us to take advantage of the waiver because they have been hearing lots of feedback from various COCs around the nation. And so we aren't aware of any major risks because we can still submit other really quality data that we collect. And that's really HUD's main thing, right? They just want to know what's going on in our region. And we find that the data that we do carry is a lot more comprehensive than the PIT data that we've collected through the years. So I don't know if the COC team has anything to add, but from HUD standpoint, as far as I know, there isn't any downside, and we won't be penalized at all, which really helps us to feel like we're making the best decision for everybody.
This is Charles. I think we don't know if it's a risk now, but and we don't have a competitive process with the COC that we know of yet with the Continuum application on a national basis. But based on where our numbers were in our last PIT count, if they're going to judge us against that when we do have a future PIT count for our reductions in length of time on the street and other data that has to do with the PIT count, we may see some risk in the future, but there's no way to judge if that will be the case. We for example, if our numbers went down this year, we might see better funding. If they go back up again next year, it might shift, but that's the only thing I can see with not doing it. But I think we also still have the option as a COC to do the PIT count every other year anyway, don't we? And so this is,
that's correct.
We could always take that option, and we wouldn't have to do it anyway as a COC. We can always choose that.
Absolutely. And I do just want to add that municipalities and providers can certainly do the count on their own full to any extent. And I'll certainly provide guidance and assistance in any way that I can. And so municipalities, there are a couple of municipalities that have decided to still go forward with it for various reasons. So we're still going to be supporting their efforts. Absolutely.
Madam Chair, this is Jackie. As a CEO of an organization, I would be very uncomfortable asking my staff to go out at this point in time, given what's happening in our community. And I enthusiastically support Sarah's recommendation that we take advantage of the opportunity to opt out this year. Thank you,
Jackie. And I agree. I just want to read something that's straight from HUD that pertains to our community, which is some COCs currently collect data on the unsheltered population throughout the year. These data may be collected in their HMIS system or other database, and COCs that use a complete by name list, active list that frequently update their list at least monthly could use that data in lieu of conducting an unsheltered PIT count. And we do that. We have by name lists for our subpopulations. We have I think we have really great data in quite a few of the areas. So I would enthusiastically support this as well. We want people to be safe. And, given the times that we're in and the amount of distance that we need to keep from people, it just doesn't seem like it would behoove us. And if we have the option to use something else, I think that would be better as well. Any other comments?
Madam Chair, can you hear me?
Yes. Hi, Ryan.
Okay. Hi. So Sarah, thanks for that report. And I appreciate all of that and agree as a human being, not exposing, taking every precaution is absolutely worth it. And I'm really thrilled that HUD is giving this opportunity. However, I just want to, I guess maybe let you guys know and see how this would work is as a municipality, there's not a lot of buy-in for not having a number, especially when what we're reporting as staff to decision makers and electeds is, we're very, we have a lot of concern about the growing numbers on the street and what's going to happen when the moratorium ends up. We're already seeing that, frankly. And so, of course, they want more data. So my question is, I have no problem personally as a municipality figuring out how to get our count done here. Happy to do that. Two things. One is, would that be considered unofficial data that we could use, but it would not be an official pit count? Perhaps I don't want to have anything that conflicts with, you know, the greater regional story. But the other thing is, do we have the opportunity, if not, do we have the opportunity to, are we able to use some of our other data sources that we would then use in the NOFA? And could perhaps municipalities then use that to fill in the gap? My fear is just that we end up having, out of our need to provide local data, we end up out of alignment with you. So I'm wondering if there's something that's going to replace, or if it's okay if we go and do counts. What are your thoughts on that?
Madam Chairwoman? Thank you so much. Yes, so my understanding, and please, Brandy, Director, if you could chime in. My understanding is that the COC itself would be the one submitting the data. And so I think that that could still happen, but I will double check that from HUD, because I don't want to say the wrong thing. Whether or not it would be quote unquote official, I would defer to Brandy on that, but you can certainly use other data sets or supplemental data to inform your lawmakers, your policy makers. But Brandy, can you chime in, please, and let us know about the official portion of that?
Sure. Thank you, Madam Chair, Sarah and Ryan, for your question. I think it's an important question, and we may need to get more detail from HUD about whether or not, if we request a waiver to opt out of the count, how that would work in terms of what we're submitting to HUD if we still have these other supplemental data that we're collecting and that we're using locally and for our continuum of care. So Ryan, if the City of Chandler is wishing to do a point in time count, our staff can support you in that in whatever way that we can. And if that means, for example, looking at other data sources, we can help you. You know, we have the by name list data, we have the outreach viewer data. So there are other data points that we can use to support you in your efforts with the City of Chandler. If you're looking at doing a more traditional street count, then we can see in what ways we could support you in terms of providing tools and assistance for your city in conducting that count. So we can get back to you on whether or not when we submit the point in time count to HUD, we submit it on behalf of the entire region, not broken down by cities and towns. So I will need to find out from HUD if an individual municipality decides to move forward with a count, how we might be able to represent that data to HUD. So I can get back to you on that specific question. But otherwise,
I think there's another couple cities that are sort of in the same boat trying to determine what route to go.
Okay.
Yeah.
Thank you. And I am aware of that, and we can follow up with each city individually as well.
Okay.
But we are more than willing to work with you to help support your efforts. And if there's additional data that we can provide to help inform the direction of the city and in terms of how you might be counting and the data that's used, we are happy to provide that to you.
Okay, perfect. Thank you.
Thank you so much. And in the essence of time, I'm going to move on if that's okay. We did want to remove item 3B from the consent agenda around HMIS and discuss that. Bruce, I believe that you had requested to remove that item, but maybe we could just go back and read through the summary and see if there are any questions or anything that we would like to discuss on that.
Madam Chairwoman, this is Steve. There was a public written comment regarding the item 6, the pick count. So I would like to read that now, if that's okay.
Yeah, of course. Sorry about that. Yes, please.
Okay. This was a memo sent via email to MAG from Wendy Johnson, the Executive Director of the Justice Center. And it reads as follows. In our last COC committee meeting, we expressed the desire for more engaged participation for actionable outcomes. Thank you for asking about our thoughts regarding the 2021 PIT count for Maricopa County. More than any other time in our history, we need a comprehensive unsheltered count of individuals in homelessness. Risk. As essential frontline workers, we understand the risks. In March, we added COVID-19 to the daily risks of violence, MERSA, HEP, ABC, HIV, AIDS, and every cold, allergy, and infection. All of our organizations continuously do everything within reason to keep our staff, clients, and volunteers safe from all of these risks. The protections taken are not too great a burden for daily work, so it isn't too much for a PIT count team. Crisis. Governor Ducey's moratorium on evictions ended October 31st, and the CDC's ban is expected to expire on December 31st. And yet already more than 900 evictions were filed against tenants who likely should have been protected by the Federal CARES Act, according to an Arizona Republic investigation. If nothing changes, the PIT count will be adding to those new evictions. Extreme number of transient deaths in 2020. 538 compared to 2019, 247, including 4 fetal deaths. This is in part due to COVID-19 and exacerbated by the lack of cooling places in the region during the record-breaking heat this year. We need to know where people are sheltering outside. Real numbers. Addressing homelessness has escalated to a hot potato that is alternately being embraced and repelled. We know we don't have capacity to move 75% of those in homelessness to a shelter at current count. In January, that number could be stunning. In order to satisfy the communities and the municipalities while helping to provide all with accurate data to provide services and support, this PIT matters more than ever before. Respectfully, do not curtail any count activities. Additionally, a larger pool of teams counting is vital to cover the widespread area. How can the committee help with this? End of comment. Thank you, Madam Chairwoman.
Thank you, Steve, and that comment is noted. All right, and then if we go back to item 3B around approval letter of support for a proposal to develop a statewide homeless management information system, HMIS data warehouse. And Bruce, you asked to remove this and have it be discussed a little bit further.
Right, Tamara. And I was just reflecting on the language of the summary of the item that said, MAG staff is asking the board to consider if CRN would have the capacity to undertake this, given their HMIS onboarding. So it just begged for a little discussion, maybe not long. Am I missing something? I don't know why it was on consent if there's a question to us in the explanation of the item.
That's a good point. Thank you. MAG staff, would you care to talk about that a little bit?
Yes, Madam Chairwoman, this is Steve from MAG. Yeah, that was added because this is an undertaking, and I see Tyler Rosenseal is here from CRN to update the board on your question, Bruce. It was put in there because I think with all letters of support and an undertaking as such regarding an RFP, it is just professional to inquire of that in that way. So that's why it was put on there. And I asked Ty to come to this meeting to respond, if need be, to that agenda item.
Hi, everybody. This is Ty Rosenseal with Crisis Response Network. Good afternoon, Madam Chairperson, and good afternoon, board. In regards to this particular request, there is really not much of an additional ask being made of either the continuum of care or of the HMIS lead at this time. This is a request to really develop a group that would drive a conversation around the development of a statewide HMIS data warehouse And this is the type of project that would actually increase the capacity of HMIS leads statewide, including ourselves and Continuum of Cares, to be able to respond to data analysis and programmatic requests that come up. And so, right now the ask is really just looking for support of the idea and of the collaboration. There is not much that is needed in terms of time from either CRN or from the MAG perspective, from the Continuum of Care as a whole. That may change as the project develops, and I believe that from a method of transparency, we want to be giving updates to the data subcommittee and through MAG staff to be able to inform the board what those would look like. But at this time, there's really not significant time commitments on either CRN side or of the Continuum as a whole. And even that being said, CRN does have resources outside of HMIS proper to be able to respond to and manage these types of RFPs. So we have included our project management and communications department to assist in the development of this application. So we're working closely with the Arizona Housing Coalition to get this application submitted and are looking for the support of the board to move forward with that application. I have our Chief Operating Officer, Andrew Irwin, here also, if there's anything he wanted to add.
Hi, Madam Chair and everyone else. Thank you for giving me the opportunity to be here today. As Ty said, my name is Andrew Irwin. I'm the Chief Operating Officer for the Crisis Response Network, and I oversee the HMIS program. I appreciate all the conversation that's been happening today. This has been my first Continuum of Care board meeting, and I could just see how much you all rely on data and how that's fundamental to where this community is going forward. I just want to first say that Amy St. Peter's got our teams together 2 weeks ago, and we had a conversation about focus on data, making sure that we have high quality data. And then on top of that, do we have the capacity to meet the community's needs? I've had an opportunity to meet with my staff internally. I've also been able to participate in a meeting with MAG staff. I'm personally confident with where we sit at the moment. And as Ty mentioned, I'm also going to be bringing in additional staff from our CRN team proper to assist HMIS to make sure that we can have projects like this happen. For me, when I hear that there's an opportunity to develop a data warehouse like this, this is the type of investment in time and effort that will change these types of communities. We have these conversations year in and year out about where are we going to spend our dollars. And I understand that we're making the investment in keeping people in shelter, making sure that they have a roof over their head. But this is one of those opportunities where we can start to tell the story, bring attention to what's actually happening in the community, and we do that through data. So from my own organization, it's worth the extra investment. We'll be bringing our staff to the table just to make this happen, and it's something that we're confident in. All that being said, if MAG has concerns about capacity, I would defer to them.
Madam Chairwoman, Andrew, from our perspective, we do not. And just as stated in the agenda item, this was presented to our data subcommittee and it was approved for action to bring up to the board.
Thank you. I'm actually not sure how we move this forward for approval. Do we just have this be separate or?
Well, it was moved to a discussion. I'm sorry, Madam Chairwoman. It was moved to a discussion item, but it still is an actionable item. So, post discussion, we could move for a roll call to support the action.
Perfect. Thank you so much. Were there any other questions or comments from other board members?
I'm happy to move approval if that's appropriate.
Oh, thank you, Eric. We have a motion for approval.
Second.
Second. Who was the second? Sorry.
I think it was Bruce.
Oh, perfect. Thank you, Bruce. All right. I'll go ahead and do a roll call for the approval of the letter, starting with Ryan Balch. Ryan, are you on? Might be muted.
Got a thumbs up.
Eric Cole.
Aye.
Elizabeth DaCosta.
Aye.
Thank you. Marshall Franklin.
Aye.
Thank you. Tad Gary.
Aye.
Thank you. Samantha Jackson.
Aye.
Thank you. Bruce Liggett.
Aye.
Joan Service.
Aye.
Charles Sullivan.
Aye.
Jackie Taylor.
Aye.
All right, it's an aye for me as well. The motion passes. Thank you. And now we will go down to a brief presentation, a little update from Amy Schwabenlander. Amy, are you on?
Good afternoon.
Thank you.
Present. Am I accounted for?
Yes, please go. Thank you so much.
I'm looking for alternatives to saying, can you hear me? The phrase of 2020. Thank you, Madam Chair and Continuum of Care board members, for the opportunity to give you a short update. I will be as brief as possible since I know we're running towards the end of the meeting. Since the last time I shared with all of you our application to add shelter beds at the Human Services campus, meaning in the CAS building and at Andre House, was put on the agenda for the City of Phoenix Planning Commission in November, and we proactively requested a continuance because there was a request from the councilman in District 7 that more time be spent with the neighborhoods to have listening sessions regarding the set of stipulations on our request. The first listening session was 2 weeks ago on November 16th, and the second session is tonight at 6 p.m. Of course, online via WebEx. And we're expecting to share information about our request, to hear from the local businesses, and for city staff really to answer any questions, as city staff met with all departments to receive input feedback to stipulations on our request to shelter more people. The next step in the approval process is with the Planning Commission, and we are on the agenda for this Thursday, December 3rd. Again, it's a public meeting on WebEx, and the registration period to weigh in, to provide support, to register as a speaker for that meeting is open until 6 p.m. tomorrow. I can send the link maybe to Stephen if people are interested in seeing what that looks like. And then we would be anticipating being on a city council agenda for January. However, that's not totally confirmed and nailed down. I think all of the conversation today is really critical. So while I'm on the agenda to talk about this request to shelter more people, I think as the board continues to have dialogue around regional planning, counting or not counting people, using more data, it's also relevant to whatever happens next in Maricopa County. And we're getting lots of questions around the city's document on how to address homelessness. I know Marshall and team have spent a tremendous amount of time with Inger putting together that document, which supports more shelters, and it supports alleviating the impact around the Human Services campus and in any areas where there's homeless services or unsheltered people. And so for us, it really is a both and. All of these conversations are both and. We need to support every effort and the other efforts. So we have over 200 people staying in tents in what we're calling the safe outdoor space, with support of Bruce and Maricopa County for COVID distancing with people who are unsheltered. And we don't know where those people will go once the CARES Act money runs out, or the county runs out of creativity that they have really maxed out to provide that space for people to just be. And as Ryan's talking about Chandler, we know across the valley homelessness is going up. So I would ask you all as individuals, if not the Continuum of Care board, to at some point weigh in and support this request to shelter more people. It will not, of course, end homelessness in Phoenix or Maricopa County. However, it will allow us to shelter over 300 more people every single night, which I'm preaching to the choir, so I don't have to tell you why shelter is important. So milestones tonight, Thursday, December 3rd, and hopefully in January. Are there any questions?
Thank you so much, Amy. Are there any questions or comments from the board? All right. Thank you so much, Amy.
All right. Thank you.
Perfect.
Sorry.
And go ahead.
Sorry, it's Eric. I had one question. Amy, there's a, I think you can share this, right? The messaging or the site where people can get more information about advocating. Isn't there something on those ones?
Yes, we have a campaign website, fromstreettohome.org, all spelled out, fromstreettohome.org, where people can follow along, get those calendar dates, and weigh in that way with support. Also, there's a Get Involved tab. So thank you, Eric, for the question.
Anyone else?
Yes, Amy, just one other question. Is it important that you're a resident of Phoenix to weigh in, or would they entertain comments from those of us that may not be Phoenicians?
I think from a resident standpoint, it's certainly important. I think as fellow service providers and colleagues, your voice is important to weigh in and, again, stress the regional need, the regional demand. I'm not putting words in your mouth. I'm giving you suggestions, Jackie Taylor. I do think support letters from providers. So if Jackie Taylor, on behalf of Save the Family, submitted a letter, I think that resonates and demonstrates it's not just the providers here asking to do this. It's with the support agreement and your words, in your words, Jackie Taylor.
Thank you.
Thank you. If there's nothing else, we can move on to a quick legislative update if there's anything from Joan. Thank you so much, Amy.
Yeah, I'll be real quick. Just at the federal level, we're watching the new administration transition and recognizing and realizing that the new HUD secretary is going to be up for a daunting challenge with the affordability crisis that we're facing, reconciling with the fact that we're all working from home, schooling from home, healing from home. And so that, how does that reconcile with the lack of affordable places to call home, as well as many of our population that don't have that safe place to call home. So they're up for a daunting challenge. We've heard some preliminary candidates being discussed. So I think ultimately, I think we're in for some. Whoever takes the office, I'm encouraged. That's at the federal level, and then ultimately, any kind of COVID-19 response, we know is. There's been discussions of it happening before Biden takes office, but that would require all of our congressional leaders to be in reconciliation, and that's not the case. So there might be an opportunity for a COVID-19 response bill before, or actually right around the time that they all have to return to pass the continuing resolution, which is December 11th. I am doubtful. I think they'll pass the continuing resolution, kicking it till when Biden takes office, and that's when we'll also see some level of COVID-19 response. So that's what I'm thinking is going to happen at the federal level. At the state level, we do have some affordable housing and ending homelessness champions still in office and new to office. We do have, we didn't get the leadership change like many had hoped, but I think those who are in leadership at the legislative level are good allies. And so we are going to be working with them to advance the Housing Coalition's priorities, which are to restore the State Housing Trust Fund, enact a state low-income housing tax credit, and reconvene an interagency council on homelessness and housing. And this interagency council kind of braids all these regional conversations across the state and allows for greater accountability, especially as all eyes are going to be focusing in on housing and homelessness. But we do also know that there's other legislative priorities from some of our allies, which we'll be supporting. For example, a statewide, I want to make sure I say this right, a statewide discrimination for sexual orientation, or I'm already screwing it up. A statewide discrimination policy which would not allow you to discriminate against gender or sexual orientation in housing. Hopefully I said that right. There was too many double negatives there, but I think you get what I'm trying to say. And then I know that there's also efforts to support, basically have a statewide funding support for 211. So those are all things that we're going to be supportive of and that come to top of mind, and happy to entertain any questions or comments.
Thank you so much, Joan. Any questions or comments from the board? Hearing none. All right, thank you, Joan. Moving on to item number 9, a request for future agenda items. Do board members have any action or discussion items for future meetings? Okay.
I would just say the housing and the data, piece was really, really helpful. So we could do that, something similar every, second or third meeting or something. That'd be great.
Yeah, thank you. Okay. Is there anyone on the board that has any announcements or events that they would like to highlight?
Tamara, just quickly, and we talked about it as part of the discussion about the collaborative group and all that, just FYI. So Maricopa County put $36 million into rent assistance. $6 million of that was IGA to the city of Mesa. The other $30 million we administered through our 11 community action programs in Glendale. And we shut down intake on that a week ago. We have way more applications than we have money. The money will be expended by the end of the week. So the commitments have already been made. It's just like we just got to write the checks now. So you start to see statewide, I know Joan follows this, there's 90 million available, there's 50 million available, different numbers out there all the time, but the county's out of rent assistance money. And I think we may have been one of the bigger in the state in terms of the contribution. So no longer available.
Wow. Thank you for that. Anyone else have announcements or events that they would like to highlight? I know if you're part of the Built for Zero crew working on ending veteran homelessness, we are going to have a large city huddle coming up in December. It's going to be December 3rd for the first session and December 12th for the second session. I'm sorry, December 10th, where we will be talking about, really centering our racial equity work. And part of that is also going to celebrate an acknowledgement that the veteran team in Phoenix has had a 31% reduction in veteran homelessness this year from our first count in January 2020. And that's been like one of the largest reductions in Maricopa County history. We've gone from around 487 veterans in January to 333 for the month of October. So that's a pretty huge reduction. And so I just want to acknowledge that for the veteran work crew, and also just talk about, give a brief update on our racial equity work really quick, that we are currently working on some training items. We did have our first, I don't know if we had 1 or 2, because I feel like I'm on a lot of racial equity trainings, but I think we've had 1 or 2 trainings continuum wide for people that were wanting to attend. And we also have some various work groups that are beginning to work on our plan, centering racial equity in our coordinated entry system, as well as trying to get more folks with lived experience and get their input. And so we've got a plan that we're working on with the racial equity work group and the leadership group. Thank you to Nikki and Dee Dee and some of the other leaders that we have on that team. And we are putting it to work now, and hopefully you'll start to see us poking around in some of those smaller committee meetings.
Tamara.
Yes.
Tamara, this is Jackie. I had to miss that session. Is there any chance it was recorded so we can revisit it?
I believe it was, right, Steve? It was recorded.
Madam Chairman, if I can speak.
Yes, please.
This is Julie Montoya with MAG. Jackie, thank you for the question. Our consultants did record it. They are going to make it available on their website. We'll be provided with a password for people to be able to access it. We don't have that yet, but when it becomes available, I will make sure that you all have that. And the next session is December 14th at 1:30, and I'll be sending out a reminder.
Awesome. Thank you, Julie. Thank you, Madam Chair.
Of course, thank you. That's all that I had. Did anybody else have anything before we adjourn?
Madam Chair, I just have one kind of update. The next board meeting is in December. It's scheduled for December 30th. I don't know if, that is during the holidays. I'm hoping that date works for you, but just know I'll send a message around inquiring. And if that doesn't work, we'll come up with another date in December to have that meeting, because it will be an important meeting to have, along with the, before the meeting, the board strategy session.
Okay, great, thank you. All right, if that's everything, do I have a motion to adjourn?
Madam Chairwoman, we do not need a motion to adjourn. We just adjourn the meeting, yeah.
Oh, well, that's wonderful. Okay, well, if there's nothing else, this meeting is now adjourned. Thank you so much.
Thanks, everyone.
Thanks, everybody.